So I'd like to welcome you to this webinar presentation of implementing smart healthcare IT projects. My name is Jeff Ostro. I'm the HCTec Director of Learning and Development. And I have here with me today Chad Oglesby from St. Luke's Health System. He is the IS Training Program Manager. So welcome, Chad.
Thank you for having me.
Absolutely. So we'll go ahead and take a look at the agenda for today. We are going to become more familiar with Chad and I about our backgrounds and the work experience. We'll get to know a little bit about HCTec and St. Luke's. We'll look at a general use case and business profile in terms of the benefits of collaborating with companies such as HCTec. We'll take a look at a specific technology application that is utilized to help a project become more efficient and effective. We'll take a look at some future features that HCTec will be coming out with, excuse me, and then we'll end with a Q&A session. All right, so to get started, again, my name is Jeff Ostro. I am, as mentioned, the Director of Learning and Development at HCTec, and I currently oversee all of our EMR training development and delivery services. Before joining HCTec, I worked for Johns Hopkins for about 14 years, the last 5 years as the Senior Training Manager for the EPIC program for Johns Hopkins Medicine. I currently have a PMP certification, and I am certified with EPIC Ambulatory and EPIC Security. So I'm going to turn it over to Chad, and he can introduce himself. Chad?
Thanks, Jeff. So I've been a part of St. Luke's for about 12 years now, and the first 7 of those years I was a trainer and have moved up into the training manager role for St. Luke's. As the bullet point says, I currently oversee all the training implementation, specifically for EPIC, since that's the largest component that we have training on. I was one of the first pilot users for this new S.M.A.R.T application, and it's definitely helped us, and I'll be talking more about it as we go through the presentation here today. Jeff, I don't know if you're muted, but I can't hear anything. I don't know if anyone else can.
I apologize. So let's take a look at who HCTec is. We are a company that focuses and specializes on EMR implementations, training, and go-live. We've been doing that since 2010. We have supported over 100 different EMR implementations. We have our corporate office in Nashville, Tennessee, and we have additional corporate offices in Tampa, Atlanta, and Steamboat Springs. We primarily offer consulting services, solution services, and managed services. And you can see on the right some of the statistics in terms of our EMR experience. So let's take a look at St. Luke's. I'll turn it over to Chad again.
Thank you. So St. Luke's is an organization within the Kansas City metro area. We have 7 hospitals within the Kansas City metro area with 3 regional facilities that we have. We've been utilizing HCTec for, well, we've had 4 go-lives with EPIC. So we're in our 4th phase right now, and we brought HCTec on with the start of phase 2, and we've used them for each go-live since. So that's from January 15 to present. During that entire process, we've had numerous trainers and at-the-elbow support from them as well.
Thank you, Chad. So let's transition over to our general use case. So we're taking a look at an IT company or a healthcare company, and they have been charged with implementing a sizable healthcare IT project, and that project requires extensive training and support for thousands of users. So the management of the leadership of the project have many different types of goals that they need to adhere to, but we're going to look at 3 specific goals. The first is recruiting quality resources. The second is onboarding those resources efficiently. And third, once those resources are on board, to manage those resources and the logistics around training and resources effectively. So we're going to take a deeper dive into those 3 areas. The first phase of the project when dealing with resources is the planning and analysis phase. And HCTec works very collaboratively with our clients to do the following. First, we define onboarding requirements. So we take a look at the types of quality resources a client needs, and we understand the culture of the environment. We understand the numbers of quality resources, and we take that into consideration as we develop our onboarding plan. In addition, we work with the client to establish the travel and logistics policy and plan that we're going to put in place. And primarily, HCTec will manage the travel and logistics, and that's something that the client does not need to worry about. We also integrate and implement any technology that will help the project progress efficiently and effectively, and we have talked about the S.M.A.R.T application, which we'll go into in a bit of detail a little later on. And then finally, we ensure that the HCTec training team and the client team get together on numerous occasions, and we really collaborate and talk about how we can successfully complete the project at hand. So continuing with recruiting quality resources, we have an extensive database of credentialed trainers, and because of that, we don't have to actively advertise on the websites that the job websites. I apologize. With those CTs in our database, we repurpose them or we reuse them for different clients. That helps us develop a relationship with them, and we really understand how they work with our clients. Every CT has a current background check. They receive immunizations. All of their client compliance documentations are completed prior to the engagement with the client. HCTec takes care of that internally prior to them going on site. And all CTs are required to have previously been credentialed in one or more applications. In terms of the at-the-elbow go-live support, again, we have numerous number of ATEs that we have certified and have used over and over again. Again, with the ATEs, they go through background checks. We ensure that their immunizations are completed, and again, they need to complete all the compliance documentation prior to going on site. So our resources are quality. We know they're quality based on previous experience, and we repurpose them. So that's definitely an advantage. And you can see on the right-hand side that there is a national presence of resources throughout the country. So as we're starting the project, oftentimes management will deal with what are called project constraints. These are constraints that have come up after the project plan has been implemented or started. Most typically, we find constraints such as a requirement to reduce budget even after the initial budget was put out. Second is the need for quality resources. So this would be an additional need of resources over and beyond what was planned. And then the plan for post-go-live resources. Maybe the client didn't plan on enough resources, so we need to work with our customers to do that. So when taking all of these constraints into consideration, HCTec has come up with a very innovative RT program, and RT stands for a program and a trainer that we call reserves. These are reserved trainers. Reserve trainers are local individuals who have adult education or previous EMR backgrounds, and they need to complete assessments and tests that we provide them to ensure that they are the right candidates to come on board. The nice thing and the benefit of reserve trainers are that they will attend a client's credentialing program at no cost to the organization, and they will go through the paneling process or the credentialing process with the other members of the training class. And only if the reserve trainers pass, they will then transition to become a billable credentialed trainer. They are local, so there will be no travel costs involved. So it's a great program to help with these constraints. So it does reduce the budget, you're getting quality resources, and then those are your additional resources for post-go live. So it's a great program. We've had folks utilize RTs, and it's been very successful. Moving along to the next slide, we have our walkthrough. So it's very important that the organization and HCTec in collaboration determine the right number of resources. We don't want to overestimate because that's going to increase our budget, and we don't want to underestimate because that's going to compromise our ability to successfully complete our project. So HCTec ensures that a walkthrough is completed for every facility, every floor, and every location of the client's environment. So specifically, we take a look at the facility layout, where the beds are, where the rooms are, where the suites are, any anticipated super user staff and printer locations, daily census, and daily staffing. These are the types of criteria we look at, and we take that all into consideration and really provide the client with the best, most accurate recruitment plan. And it again, has proven to work really, really well with our clients that have utilized this program. I'm going to stop there. Chad, is there anything you'd like to add in terms of reserve trainers or the evaluation walkthrough?
You know, the reserve trainers, it's a program that you guys started right as we were doing our third phase, and it's kind of one of those I wish we had it set up for phase 2, because I ran into a situation where you know, I was given, as you mentioned, budget always being a concern. To get like X amount of dollars, you can hire 15 trainers. Just can't remember the exact number, but 15 trainers. But then as more build gets in place and more classes get created, it's like, man, I need 17 trainers now. I got 2 more trainers. Where can I get this? And the nice idea of the reserve trainer is that they could be there in place as that buffer, as that backup to say, all right, let's cushion ourselves and add a couple extra trainers, and if new classes show up, great, we have a CT already in place. Or if one of my hired CTs falls out, hey, I got a backup already in place. And so it definitely is a nice cushion to help alleviate some of those concerns about CTs falling or going to different projects or just not, or failing for that.
Excellent. Thank you, Chad. Great detail. All right, so we now understand what our recruitment numbers are. We now move into the onboarding process. So we've identified, we've planned, we've analyzed, now we're ready to onboard our folks onto the project. One of the most cumbersome processes is the interview process. HCTec is very, HCTec is, I'm just trying to think of the right word, they really want the client to interview the onboarding of our recruits, our trainers. So what we have done is we've created what are called dashboards, and we've utilized video interviews. And this allows the management of the client to visually understand the experience of the folks coming in. They can look at their resume, and they can also click a link to look at a video interview. 9 times out of 10, this will allow them to make the decisions that are necessary without having to get onto a phone call, without having to do a Skype call, or even have an in-person interview. So those dashboards and video interviews are very, very efficient, very effective. HCTec does the initial work of finding and creating the list of potential candidates, and then the client makes the final decisions. Once our resources are identified, then we require those resources to complete our LMS courses internally within HCTec, courses such as the HIPAA compliance, customer service, fire and safety, and things of that nature. So all of that is done within HCTec internally, so that once they come on site with the client, they don't have to worry about doing any of that. And HCTec provides all the necessary reports and completion certificates necessary to the client leadership. We also, as mentioned earlier, that we ensure that all resources have completed the compliance requirements. So their vaccinations are up to date, their immunizations are up to date. Everything is done so that when they get onto the customer on site, then they are ready to go. Right? And then we also take a look at the RT program, and we look at each RT that has been selected and determine if there's any risk in terms of the RT's background, their lack of knowledge, and we do a risk mitigation to determine whether or not we feel they're going to succeed. And then we also take a look at how much RTs will save on a given budget. We're not saying that the RT program is good for every situation, but we do look at each situation differently. We take multiple items into consideration, and then we make the recommendation to the client. So this is the onboarding process that we typically go through. Again, it's proven to be very efficient and effective.
And Jeff, if I could, I'll just speak to this one component of that real quickly. Those dashboards with the videos, that was really helpful. I had to hire, I think, 18 credential trainers for my second phase, and there were like 35 applicants that I got sent, and I was able to quickly go through and not only look at the resume, but that video was a really nice tool to be able to see the actual enthusiasm or the how involved they felt they were with that. And so I was able to narrow that down from 35 or whatever the number was down to maybe 20, and then say, okay, now let's do a phone interview just to make sure that these are the people that we want. And so it was definitely helpful to go through and help us with that.
And Chad, did you feel that you saved quite a lot of time using the video interviews versus having to make phone calls?
I'll say I was saved a little time, and the reason I say it that way is because when I have all the paper applications, I just have to go more with some gut instincts, and because I just don't have all the time in the world to phone call every one of them. So I just had to do some gut instincts, reading experiences and backgrounds of those individuals and say yes or no. But what this allowed me to do, I think, was make a much more better informed decision. And now I don't know, again, if that correlated to better staff, because I don't know who I turned down before we had the videos. So I can't really make that correlation, but I definitely had a better feeling about the people that I was hiring because I was able to see that in-person component for that.
Excellent. Thank you, Chad. So let's take a little bit of a deeper dive into that process. As we know, everybody has a ton to do. And as we're onboarding, it's really important that HCTec, again, collaborates with the customer and really takes on all of the onboarding tasks, if you will. And those are tasks such as travel logistics. HCTec takes care of all that. We work with a corporate travel partner, and they're available 24/7. They manage our travel for us, and everything works really well with them. As we mentioned, we make sure that all immunizations, drug screenings, background checks, and education verifications are completed. We have a fully dedicated team in our corporate office in Nashville, and they help us manage the onboarding recruiting, screening, travel management, and payroll and invoicing. So we really do have that dedicated team in place, and they take care of all that, and they do an excellent job so that the client and the customer, they don't have to worry about that at all. So as excuse me, as the last bullet point states here, we have managed I'm sorry, over 800 consultants nationwide on a weekly basis. So wow. I apologize. So again, just to reiterate, HCTec has, you know, a real investment in taking over the onboarding tasks for the customer. Bringing all this together, two really important items are: one, collaboration is continuous. Throughout the entire process, HCTec collaborates with the client in all of these phases: the planning phase, the development phase, the design phase, and the delivery phase. As well as communication. It's extremely important that we have open communication between the HCTec leadership and the client leadership. Some of the areas that I want to point out is that, you know, we help out with strategy documents, we help out with curriculum mapping, we manage scheduling, and we manage resources, and we manage the orientation for those resources. So we're very involved in the process, and that's important because we've done this over and over again, and we know what works, and we know what will work for our customers. So it's been very, very effective, this process that we have put in place. In order to be successful, we need to put in place the proper org structure and escalation process. So this is a key to success. Again, having the right experienced resources and logistics management team in place, and that they continuously collaborate with the training and project management leadership. We also want to make sure there's a clear escalation process. It's very important that the on-site training manager from the HCTec manages the credential trainers in terms of human resources and scheduling. That's not the client's responsibility. We also put into place credential trainer leads, and they're responsible for overseeing the CTs and RTs, and they have more experience. They've done multiple projects, and we really do count on them to help the on-site training manager in managing the entire process. Again, alleviating the client from having to do that. On the right side, the go-live side, we have a similar process where we have ATE, or at-the-elbow team leads, and they are, again, senior resources overseeing the at-the-elbow resources. So this is a very dynamic org chart and escalation process, but again, proven to work very, very well.
And Jeff, I can actually speak to that very, very quickly, to the point that for our first go live, we had another vendor that it was horrendous for the go live support. It got to the point where our vice president actually ended up coming down to the command center to help organize all of this because it was just so bad. For phase 2, it really turned around with HCTec on having those at the elbow team leads to coordinate all the resources. It was immensely helpful to have all that organization in place, and allowed for a much smoother go live for our second phase that we had. So I really enjoyed having this type of logistics and resources in place.
Appreciate that, Chad. You will notice that I am on the org chart. I do oversee every engagement. I am on site for every engagement, and I do work very closely with all the training leadership because I personally am invested in each project and want to ensure that everything runs smoothly. All right, so let's move on to scheduling. For those of you on the call that have done scheduling for a large project, we know that it can be a daunting task. And we're going to talk about the old way, and we're going to talk about the new HCTec way, and it's a huge, huge difference. So commonly, folks will create a very large schedule using Post-it notes on boards. They might use multiple Excel spreadsheets, SharePoint, Outlook, an Access database, maybe even LMS. And utilizing all of these tools really can become very cumbersome. There's a lot of manual input, and there's a high risk of errors when doing that. I did when I was at Johns Hopkins doing the first go live, and it was awful. So we needed to come up with a way to pretty much automate this process. This slide is a flow of what typically occurs with a manual process. I'm not going to go into detail, but basically you create a calendar on the wall, you use Post-it notes, you move them around, and this is an iterative process that takes weeks and weeks and weeks. Once you have the schedule done, you then have to have multiple resources enter that into a spreadsheet or an LMS, and the process, it's expensive, it's time-consuming, it's resource, overusing resource, and it's just not an efficient process. So some of the common issues with that manual process is that the schedule has very limited accessibility. Again, if you're managing all these applications, typically one person has access to it. It's very time-consuming. Performing data analysis is practically not available. There's a lot of redundant processes, and it's very hard to use. So what HCTec has developed is what we call the S.M.A.R.T application. Stands for Scheduling Management and Resource Technology. And this application is currently being used by many healthcare organizations, and it has proven to eliminate scheduling inefficiencies. So no more double booking of rooms, double booking of trainers. There's two options for creating schedules. A user can create a schedule using a very easy drag and drop functionality, or the system can create for you a draft schedule, an initial schedule based on criteria, and then you just modify it, saving tons until you could create a large schedule within minutes using the system. It's going to reduce your high costs, limit to one or two resources. It's a cloud-based application, fully integrated with any LMS, and it's very easy to schedule and assign trainers. You see on the right-hand side some of the statistics that our clients have come back to us with. 80% reduction in materials, 75% reduction in labor, 60% reduction in resources, and ultimately 80% increase in efficiency. So let's take a look at this application, and then we will talk with Chad about how he has utilized this application. On the left-hand side, option number one, users have the ability to drag and drop their schedule, their courses into the schedule to create the schedule, which I will show you in a couple of minutes. They have the ability to schedule blackout dates, so specific dates that you're not offering training, you can put into the system, and it will not allow you to schedule on those dates. You have the ability to specify days of training, so if you're not training on Sundays, you can identify that, and the system will not schedule on Sundays. And there's also a fully dynamic data analysis dashboard and reporting capability. Option two is a functionality we've just added, and that is system created schedule. So the user will identify criteria such as any applications or courses that need to be offered on specific days or specific times, any applications or courses that need to be offered in specific classrooms, any blackout dates, and then what is the default duration between classes. Once this criteria is entered, you can press automate, and the system will create a schedule for you. It could be a 3-month schedule. It could be a 6-month schedule. You put in the parameters, and the system will create it for you. And then all you need to do is go back and modify it as needed. And I'm telling you, you can create a large implementation schedule within 1 day. And that's the beauty of the S.M.A.R.T application. There are 3 roles that are accessible in the S.M.A.R.T application. On the left, you have what's called Organization Administrator. So for your site, you can identify an administrator, and they will have full access or full functionality to your organization within the application. There's also a trainer view or role, and that allows trainers to go in and view their schedules and view dashboards and reports, which is very handy. For example, if a trainer needs to find out if there's other trainers in the same building on a given day, they can do that. And then there's also view only for leadership and folks who just want to view schedules and reports. So these are the 3 primary roles, and as I mentioned, it works extremely well. All the data analysis and reporting, it's all done for you. This is an example of the scheduling template. You'll notice on the left-hand side, we have a list of all the classrooms available to us. It identifies the classroom name, the location of the classroom, and the maximum number of seats for the classroom. On the right-hand side, we have a list of all of our courses. All of the courses are grouped into applications, and then they are color-coded. You can see the specific color on the left-hand side of the block. We also have the duration of the course, the number of recommended sessions. This application will take the place of a training calculator and really tell you with precise accuracy how many sessions of each application you need. And then the last number is how many you've currently scheduled. And the process is you just drag a class onto the schedule, as you can see here. You can see the different colors represent the different applications, and we can identify 1 or 2 trainers and a super user for each course. So that is how the application is typically laid out. You'll notice that on the upper right-hand side, you can see the different components of a course block, and then, as I mentioned, we just drag. So in this case, we would drag Nurse 100 over to Monday, March 27th at 8 a.m. And then it comes up with the screen. And when you drop down the primary or secondary CT, it will only list the CTs that are available. So this will eliminate double booking of trainers and eliminate double booking of rooms as well, which is very, very handy. We also have the ability to create a report and export that, and we can filter it. So if you want to filter on specific courses or specific applications, that can be done by any of the roles. So the administrator, the trainer, the view only, they can all run this report at any given time. This is an example of the dashboard. The dashboard provides us with real-time information. If you take a look at the bottom center, the recommended sessions, it's going to identify for each course the recommended sessions, and then we can also split them up within the time of day. So WD day stands for weekday day, weekday evening, weekend day, and weekend evening. All of those numbers are taken into consideration to, again, provide you with recommended sessions, which has proven to be very accurate. On the bottom right, we can see if any trainers are scheduled for over 10 hours a day, so they're being overutilized. And likewise, on the right of that, any trainers who are under 10 hours a day who are underutilized, and this will allow us to even it out. Similar to that, in the top right corner, we have any trainers working over 32 hours a week. This is really nice, especially for our external trainers or consultants, because we typically budget them for 40 hours, and we want to make sure that they're not being overutilized. So very comprehensive, dynamic dashboard for your use. Excuse me. As mentioned, the S.M.A.R.T application integrates with any LMS. The typical process is you create your schedules in the S.M.A.R.T application. You then export them using the scheduling report functionality. That is then converted into a file for your LMS, and we work very closely with your LMS administrator and the vendor to get this file. and then you're able to import the enrollments into the LMS. So you no longer have to manually enter each class one at a time. It's a one-time upload, and you're done. And that's a huge, huge time saver. So I'm going to stop there, and Chad, if you'd like to just give a little bit about your experience with the S.M.A.R.T application, and you've been a part of it from the beginning.
Oh, most definitely. Thanks, Jeff. You know, at the very beginning, when they showed the Post-it note wall and all the different applications that were used, that was me to the T, except SharePoint. We used everything. We did the wall, the Post-it notes, spreadsheets, Outlook, LMS, everything, and it was crazy. I haven't run the numbers myself to validate, you know, a drop of an increase of 80% efficiency or, you know, decrease of resources, but I can tell you it took me 2 weeks with 10 people to put our first schedule together, and it took 2 people in 2 days to put the first draft of the S.M.A.R.T schedule together. We didn't have all the functionality in place yet because I was one of the first pilot users for this, like with the import file, so we had to create all our import files and some of the other, the auto-generating of a calendar or a schedule. So I can't speak to some of those, but even with the core basics of the application, it greatly reduced our time and resource needs for creating that schedule. So that was immensely helpful for us to do that. So for this phase, you know, like I said, we're currently using it for this phase. It was great in putting all the individual pieces in place, and it's having it being in the cloud versus in a hallway in our office where we had someone who physically had to be on site. Being up on the cloud and be able to log in from anywhere and be able to talk about who's currently enrolled and who's not, or the different scheduled classes, it has been a great benefit for us.
Absolutely, and we do include this application with our training services, so it's included in the fee. There are other details that we can talk about after, but it's proven to be a really beneficial application. So what's coming up in the future in terms of our future features? So some additional features for the S.M.A.R.T application, along with the automated schedules, is we're going to implement a feature to automate trainer assignments. So very similar to automating schedules, you'll identify specifications, and the system will automatically assign your trainers to sessions, avoiding things such as overbooking trainers, ensuring that trainers are not in 2 locations at one time, which is fantastic. There's going to be a more efficient user interface, and then finally, improved reporting capabilities. And second, we are going to be implementing a virtual training program. This virtual training program will allow us to provide training to an organization virtually. This will reduce costs tremendously because there's no travel cost, and there's a huge benefit to the organization in terms of learning anywhere, anytime. So at the bottom, you'll see some of the realized benefits of virtual training. As stated here, it's very adaptive to today's work style. We know that many folks work remotely, so they don't have to come into a central training center to train. It's a focused learning engagement, results-oriented outcome in less time, a huge reduction in costs, really focusing on time and expenses. So your providers, for example, will spend less time in the classroom, more time in the clinic producing revenue. And that's where the last item comes into play. You'll see an increased revenue because your providers will have more time with their patients. So that ends our webinar presentation. We will now go into open forum with questions and answers. So if you have questions, please go ahead and submit them using the question and answers functionality of the webinar application. we'll go ahead and wait a couple of minutes to see if any questions come in. We will be sending some information out to all of you in terms of this presentation, and then we can have individual conversations if you would like more detail about any of our services. Okay, oh, there's a question. All right, so Shelley asks, what are some additional lessons learned from previous customers besides St. Luke's? So in terms of lessons learned, I think that, you know, as folks embark on an implementation project for the first time, they don't know what they don't know. And it's very important that the vendor that they collaborate with has the information to provide to the organization so that the same mistakes are not made going forward. So it's enjoyable for me to go into an organization and say, these are the items that you really need to do to be successful, therefore eliminating some of the typical errors or the typical processes that just don't work. And instead of finding out after the fact, it's a more proactive approach. So Shelley, I hope I did answer your question. Other questions? All right, so if there are no other questions, I would like to thank all of you for joining. I would especially like to thank Chad for joining me today. And I hope everybody has a great rest of their Wednesday. Thank you all very much.